into muscular flexibility for week two's information. So let's just go right into it because I think trying to have a lead up to this is really not necessary because the information is very easy to follow. It's really nothing more than we don't have to go too far into detail in this intro because I think everything is spelled out very correctly here. So well, really, what is muscular flexibility, or what is flexibility in general? It's basically the ability to achieve a full range of motion around a joint, and that's really what it comes down to. Now, obviously, they add in without causing injury, because you can have range of motion and it can be inappropriate, which means that obviously it has moved in a way it's not supposed to. So, but our range of motion, like it says, an entire arc of movement of a given joint, the acceptable range of motion that we're looking for. And each area, each joint area does have a very specific amount of flexibility that it can get and achieve. Now, you might have people that are hypermobile, that may be able to, be able to move a little bit more than others, but that whole advent of being double jointed and things like that, that's really a kind of a misconceived kind of a term. So it just means that they have excessive range of motion, or they have very lax joint locations, or they have very good mobility or flexibility. Okay. One of the things we don't want to have obviously happen is having our muscles become forcibly tight, meaning that and then of course accrual of tightness. So we always want to make sure that we can maintain that proper range of motion so that we can not lead to injury later on down the road. Now, if things become unstable or if things become loose, we can always have a dislocation or a subluxation, which is a subluxation, a partial dislocation, but or dislocation, a complete removal of one area of the joint that has come together. So, having too much flexibility or actually too much range of motion or too much mobility can also lead to that other side of where, too good of something can always be, a negative as well, because as you start to lose optimal range of motion or mobility or flexibility, you start to lose that stability that is very important for a joint. So we always have to think about that in the back of our head. Okay. Obviously, there are some important parts here, because with good flexibility, it means better elasticity of muscles and connective tissue, therefore improved power, improved strength. That's where that comes from. Greater freedom of movement for sports and recreational activities. Well, that's for athletes, but also greater freedom of movement for those who, or everybody really, because you figure if you have a greater freedom of movement, that means that you can become more independent, and therefore those like individuals like the elderly population, older adults, children, they can benefit from that freedom of movement because they don't feel so constricted in what they're doing. And then obviously turning, lifting, and bending for all sorts of ADLs or activities of daily living. All right. So, flexibility is great and all, but, how do we maintain? Well, stretching is obviously one of those aspects there. Also, repetitive movements can really help improve flexibility as well and keep muscles and joints in optimal working form. So, there has been some research that has shown that, even if a person doesn't stretch, they can still maintain some degree of flexibility or mobility that they may have around that joint, because they're still moving it. They're causing that stretching and that relaxation of the contracting or the stretching component of those muscles. All right. This was a constant, bend, with the bending and lifting and turning and everything like that, it's creating a lengthening of the muscle and a shortening of the muscle. So what ends up happening is you have this movement that's allowing for our muscles not to become stagnant, and therefore they don't become tight and rigid, which we don't really want. And that goes with the soft tissue like the ligaments and tendons and connective tissue, and cartilaginous tissue that we might run into as well. Obviously the main way besides just regular stretching is having a dynamic stretching program where we are very much, we're very different in how we, stretch. So when we come into class on Wednesday, we're going to really be aware of the fact that it's not just about reaching down, touching your toes. There's going to be other things that we can have from this. But with dynamic stretching, we can have all of these improvements that we see here, increased blood flow, better mental health because you just feel better. There's a relief of muscle cramps. Over the long term, improved posture and prevention of low back pain and then chronic pain as well. All right. So what are some of these factors that we have to be aware of when it comes to flexibility? Well, joint structure is one of them. Everybody's joint structure varies. So, individuals who have broad shoulders, it may be very difficult for them to do, specific shoulder stretches or shoulder movements because of the fact that their joint structure is actually impeding them from going in different directions. All right. It could be that, hips are too wide, hips are too narrow. Any of those factors can affect you, right, when it comes to joint structure. Adipose fat or adipose tissue, what we're saying there is that technically, we're not going to mince words here, but the fatter a person is in particular areas, the harder it's going to be able to be more mobile. So let's use an individual who might have a larger stomach. Well, if you're trying to do a very simple hamstring stretch where you have to, either seated on the floor trying to reach out, touch your toes. If you have a very large stomach, even though your hamstrings might be flexible, you cannot stretch because your stomach is getting in the way of you being able to reach down and touch your toes. So we can modify that for people, but the general stretch cannot be done because of that. But again, over the time, that may become more of a problem because you might get frustrated and stop, and then therefore you end up with problems with, flexibility and range of motion in general. So therefore you become more unhealthy, and then it becomes more of a challenge to help correct those. Elasticity, all right, and then genetics. One of the two areas to pay attention to, and you probably will be tested upon these, is plastic and elastic elongation. Plastic elongation is permanent lengthening, so that's more, if you were to continue a stretching program, you can have plastic elongation, which means that, the more you stretch, if you were to stretch every day, like you're supposed to, what'll happen is you'll have these changes in soft tissue length, and therefore you can be able to go through range of motion better, you're more flexible, things like that. Plastic elongation can also occur if you ever had an injury to a particular area where it can either permanently lengthen it or it can keep it the same length because maybe there's something affecting it where that injury caused that. So you get where we're going with that. But plastic elongation is it's a permanent change in the soft tissue length. Elastic elongation is in that moment. So, if we're doing a stretch before, or we're doing stretches before we're doing activity, we'll have elastic elongation, which means that in that moment there's a temporary lengthening of soft tissue, and then at some point it will go back to what its resting lengths were. But if we continue to keep up on our stretching, our range of motion activities and everything like that, we can create elastic elongation all the time that will eventually accumulate to plastic elongation. Body temperature, very simply put, cold muscles, cold connective tissue, or things that have not been warmed up correctly, they have a tendency to be, they decrease the amount of flexibility a person has. If you live in the north and you ever woke up to a cold environment and then you try to get up out of the bed in the morning, you feel very, you don't feel the same because you feel more tight because the muscles are actually, they are not having this ability to stay lax because of the temperature. All right. And that's also one of the main reasons why we have to warm up. That's why we never stretch on cold muscles, meaning we never stretch on muscles that have not been warmed up in some way. Okay. And then age, as you age, we know that children can have a tendency to have higher flexibility levels. And then until that adolescent stage, and then once maturity, maturation sets in, and we start moving into that adult phase, that's when we start having those concerns. And then as we age more, that we have more and more concerns if we're not taking care of it. For gender, in general, we technically, it's not an assumption, but typically females have better flexibility than males. And then the more physical, like I was talking about before, with physical activity, technically you're more active, so therefore you are, as you become from sedentary and become more active, you have increased your physical fitness or physical activity levels, and more times than not, you are stretching more or you're going through ranges of motion through movement, so therefore your flexibility tends to be better than the rest. Okay. Now, again, for this assessing component, there are assessing factors that we can do. I'll show you those in class on Wednesday, but the sit and reach test is that box test where you reach out and see how many inches you can reach or centimeters you can reach forward. The shoulder rotation test is actually also known as the back scratcher test, where you're trying to reach one arm over your head and back, and you bring the other arm around and up and try to connect them on your back, and trying to touch both sides. That's usually the one where joint structure really becomes a factor in that, in failing or passing that test. And then total body rotation, we don't do a lot of that here, but that is actually where you would rotate on against a wall to a ruler, and that ruler would actually measure how far you can rotate under specific circumstances by keeping the hips against the wall. So those are just three simple ones, because we do not have a total body flexibility assessment that we can check everything with it. Okay, everything has to be broken up into segments. So in terms of muscular flexibility, we have to be able to increase our range of motion, our joint mobility, but we also need to be able to provide that via a regular stretching program, and that sometimes can be very difficult. A lot of times it's time management, it's what you do for a job. If you're an office worker, you have to tend to that a lot more. Because of being seated for so long. So yeah, having this dynamic, comprehensive, well-rounded flexibility program really can make a big difference in how you feel. All right. So in class on Wednesday, we're going to go through some of these. So static, that's more of the typical, reach down, touch your toes, pull your heel toward your butt and stand up straight, where you're holding the end range of motion. Ballistic, on the other hand, is more that what you would find in like martial arts. You'd find more of this in the athletic population, where it's more jerky and bouncy, where you're staying in one position, but you're going through these repetitive bouncing motions. And again, if you're a person who's not used to that, that can cause higher risk of injury. So you got to be very careful with that. So, for our sake here, check the Blackboard site so you can see some examples of ballistic or static, dynamic or PNF, so you can see what they look like. And then, like I said, we're going to go through those in class as well. Dynamic stretching is truly one of the more important ways of stretching, because we are able to go through ranges of motion that mimic what our exercise session might be. So if, just say, walking lunges are an example of a dynamic stretch. Marching, or what we call Frankenstein marches, where you're actually bringing the arm to meet the opposite arm, meeting the opposite leg straight out in front of you, but everything's straight. All right, butt kicks are an example of that. High knees are an example of a dynamic stretch. So they're more fast paced. They're using momentum, but you're getting the muscles to go through full range of motion and stretch during that process. And then PNF is what we would call contract and relax. So what we would do, just say we're going to stretch the hamstring, we lay somebody, and again, we'll show you this in class, but we lay somebody down on the ground, and what we would do is to stretch the hamstring, we'd lift one leg straight up into the air to flex the hip, and then what we would have somebody do is, as I'm holding that leg, you're going to press back against my arm as I'm providing resistance, and that's the contraction. And then I'm going to say, okay, now relax, and I'll bring it back to resting position. We'll go back up again, and there should be an increase in the range of motion. Contract again, relax, and then do it one more time. And typically that contraction will last for about 10 seconds or so. You'll release it, let it rest out, and then go from there. Okay, so that's PNF, but we'll definitely show you that more in class. But again, check the videos for that when you see it as well. All right, so for our stretching, what we have to make sure of is we have these two proprioceptors that are in our system, and these are definitely going to be something you want to pay attention to as well, that you're going to get tested upon. The muscle spindle and the Golgi tendon organ. And they are two proprioceptors that are found in two specific areas that will dictate how your body responds to a stretch, okay, or tension within that muscle. So again, the muscle spindle, it's a proprioceptor. It's found in the muscle, in the belly of the muscle, which it says it in the name, so that's going to help you for that. Okay, and what is it doing? Its job is to detect the change in basically length or the stretch of the muscle. So if you reach down and standing straight, reach down, touch your toes, if you can't touch your toes at some point there, you're going to feel that end range, and you're going to feel that tension, or not tension, you're going to feel that stretch in the back of your leg. Well, at some point there, you're only going to go as far as what the muscle spindle is telling your brain to do, meaning the muscle spindle sends a sensory input to the brain that says, okay, stop right there and don't go anymore, because if you do, you might get hurt. And that's how that comes into play. And then once it releases, when you go back down again, the muscle spindle is like, okay, well, I can go a little bit farther because that stretch doesn't feel as harshly as it did the first time, and so on and so forth. The Golgi tendon organ is technically located where the tendons and the fiber of the muscles connect. So where the tendon comes off of the bone and reaches the muscle and connects to it, that's where you're going to find these Golgi tendon organs. And what they do is they detect tension. Okay, so like muscle spindles detect length, Golgi tendon organs detect tension when it's being stretched, and therefore it'll say, okay, I don't like that, so we can stop that, just like we said with the muscle spindles, okay? But make sure you know the difference between the muscle spindles are more about detecting changes in length or the stretch, whereas the Golgi tendon organs are more about detecting tension changes. All right. So just like we talked about in the previous chapter for cardio, if we look here at again, frequency, intensity, time, type, volume, and they say pattern, but we know P means progression. All right. And with that, what we're looking at is, how are we going to plan something effectively? So with frequency, the initial stages for somebody, 2 to 3 days. All right. So if on a test question you were asked, a beginner should spend how many days stretching? 2 to 3. And then what do you want to build up to? 5 to 7, or the best response would that be if they could do it at least every day if they could. All right. But what you're definitely going to be able to do is over the course of 2 to 3 months or 6 to 8 weeks, whatever, you can actually back off of your stretching program, but you want to build up those initial stages of improved ranges of motion, and then after that, 2 months or so, you can go and back it down to 2 to 3 sessions per week, and you can maintain that just like you would anything else. So the intensity or the degree of the stretch is going to be mild discomfort, no pain, no stress, okay? And then from there, depending upon what you're doing, you're going back to starting position gradually and letting the stretch run its course. Time, well, that depends. If you're doing a stretching session, it really does depend. It may take you, it says here at least 10 minutes. If it's 10 to 15, if it's 10 to 20, that's your call. But again, one of the things that we want to be paying attention to is we want to at least have 10 minutes of stretching throughout the day. Now, typically what we want to do is we want to make sure that we hold that end range for a total of 60 seconds. Now, we can hold stretch lengths longer. There's nothing that's going to create pain or discomfort if we hold it longer, but understand that a new person or someone getting back into stretching may not be able to handle that. So that's why we build up to that 60 seconds of total hold time, and then we can, as we get more flexible, we can change up that mentality. All right, so 60 seconds of total stretch for about 10 minutes or so a day if you can get it done, and that can be sporadic throughout the day. When's the best time to stretch? Obviously, we said not on cold muscles, but we want to make sure that really, if the type of stretching really should be done after you've gone through and done movement. So even if that's after your training session, but if you're trying to think of something before, That's why we a lot of times do, for most people, we do like a cardio kind of like light warm up or movement warm up so that you can get into some stretching. Because one of the things that we have to be aware of is that, and if we went back to really quickly the types of stretching, that we look at, when we talk about static, ballistic, dynamic, PNF, really when we're talking about before any sort of movement, or activity, we always want to do dynamic, and there's really good research to back up that dynamic stretching actually improves performance. Doesn't matter if it's just exercise performance or athletic performance. Dynamic stretching improves performance no matter what type, versus static stretching, which should be done afterwards. And that's the one that, after you're done with your activity, you can do those whole durations if you want to. Okay, but that's really the most important thing to understand. Dynamic before, static at the end. All right. In terms of flexibility, all right, one of the things that we have to be aware of is that, you need to make sure that you're at least, it doesn't matter if you're doing an upper body only workout, you still want to stretch the lower body. So you want to get at least one lower body stretch per major muscle group so that you can stay on track and, make sure that you can, maintain that level of range of motion. But we got to be careful though, because of something we call contraindicated exercises, or so if there's also the term that's called contraindication. All right, contraindicated exercise or contraindication, that means that if you are a person, just say you had a previous injury or whatever it is, if you're saying that it's contraindicated exercises, that means that if you do those exercises, it's only going to cause more pain, more risk of injury, or some other negative event that would happen at that point. So we got to be very aware of that. No, and like it says here, even safe exercises can be hazardous if performed incorrectly. So we always got to be paying attention to contraindicated exercises. If someone has low back pain, we got to be very careful about what we provide for stretch for them, because we do not want to flare up any sort of pre-existing injuries that they have. Okay, that's really the main important part of that. Now there's a whole bunch of contraindicated exercises here. I'll blow this picture up. Some of them, whoops, here we go. It's going to go over the title, but that's okay. If we look at a lot of these, some of these things we actually see, a lot in what we do. I have been an Olympic weightlifter for a few years now, for a long time now. And this right here, if you follow my mouse cursor, you see where it says full squat? Well, as an Olympic weightlifter, you need to get into that full depth squat. But again, be very, very careful. Double leg lifts. We do those. People do those. Upright double leg lifts. So these types of things, V-sits, but again, they're contraindicated because if there's a concern for somebody, a full squat, low back pain, knee pain, ankle, or low back injuries, knee injuries, ankle immobility, that's what we're saying here, is that we don't want to do these things for those particular reasons. Head rolls. I know many years ago we stopped doing head rolls and we do side to sides and front to backs. Knee to chest with hands over the shin. That's actually been good for back decompression. Swan stretches or Supermans are programmed in a lot of people's. So again, it's what you look at this standpoint of as, okay, well, if I'm trying to do something like this, I got to make sure I know what my people can and cannot do. So if they have any negative problems with their body, we shouldn't be doing some of these things because it puts them more at risk. So don't think we can't do these, but just understand that with specifics in terms of bad posture or pre-existing injury, we might want to not handle those, okay? So again, there's low back pain. I know that I think it's something like 82% of people experience low back pain at least once in their lifetime. All right. Now they say about 60 to 80% here, but I'm not going to test you on that. But that just means that basically 8 out of 10 people in their lifetime, 8 out of 10 people will experience something with their lower back, which means that we have to make sure we're taking care of it. All right. And causes down here, you can see stress is one of those. So stress does create tension and working and muscles that we use in our lower back. All right. Body weight, inactivity, poor posture, All those factors come into play there. So what do we got to do? We got to work on improving that posture, trying to make it so that the lower back does not get blown up. All right. So again, with benefits there, we can, our way of feeling, our way of looking at ourselves, our confidence are all built up. It improves balance and endurance. We don't have to worry about our center of gravity being changed, so balance improves and endurance. If our posture is not correct, it's going to hurt more the longer we stay into something. All right. There'll be less likely chances of misalignments, for the elderly population or even for athletes, because they're always in that balance and coordination structure. It might prevent falls. Obviously, it'll, oh my gosh, body posture can actually help reduce, lower back pain. All right. And then you just feel better. Okay. So, what are we saying here? Posture tests we can look at. Okay, so if you have something like an Align-A-Bod, or if you want to send somebody to a chiropractor, if you feel that that's an appropriate thing for them. But there's ways that you can look at posture and make these corrective decisions to, okay, let's try to fix this posture if we can. But these concerns here, and you can read those this is when you would call a physician. And if it had like numbness in the leg, well, if it happened one time, we don't need to be calling the physician, but if it's a chronic repeated thing, and so on with the rest of them. Okay, but that's, anytime that you feel as though something is becoming not normal, that would be when you have your people have to call their physician. All right. And then from there, there's a lot of things for treatment. Obviously, these two things here at the bottom are going to be your last case scenario. But again, I like this here. Up to 90% of people heal on their own because they're taking some strategy, and hopefully it's not surgery or pain medication, because that's not healing on your own. But spinal manipulation, that might, still kind of falls in the not your own, but it's always a good thing to kind of consider, getting adjusted, because our bodies do become out of whack. Okay. And then lastly, again, we got to just make sure that we're trying to, with lower back pain, fighting the symptoms is usually always the hardest thing. So what do we try to do? We try to make sure that we do preventative. We try to do things. We're not doing reactionary things. We're trying to do preventative things. So we want to make sure that we work on corrective means to help with low back pain. We want to correct things, and improve our flexibility. So if that means that we have to do things a certain way, then we do, so that we don't flare up any existing injuries or start losing the ability to move around independently. All right. So we have to make sure of that. Well, one of the things that we have to be aware of is that typically, well, I shouldn't say typically, but many times there is this whole advent where the lower back is hurt, but we need to realize that it may not be the lower back that's actually the root cause of the problem. The lower back is taking the brunt of it because it's the central region of our body. So we have to be able to be very critical on where is the actual pain reference from, not causing referred pain to the lower back, or what is it that's not moving correctly that we can determine, so that we can change that, make something stronger if it's weak, and make something less bound up if it's tight. Okay, and that's really what we need to pay attention to. Okay, so again, we'll spend a lot of time going over stretching and things like that when we come into class on Wednesday. But this, or if you're looking at this after Wednesday, no, we went over this during class time. Okay, so I appreciate you guys taking a listen. This lecture actually is kind of shorter, so we'll spend more time definitely going over this during our lab time that we have dedicated to us. So. I appreciate you guys listening, and I hope to, hear from you guys soon. Take care.